For this week's discussion, we watched a video, listened to a podcast from the New York Times website called How the Bad Blood Started. What has stood out to me most was how the podcast connected the long history of unequal healthcare access to one family's real experience. The woman in the video talked about her Uncle Eddie, and his story honestly felt like a snapshot of everything that has gone wrong in our healthcare system for generations. She described him as a jokester who called her Bird, someone who loved listening to music and watching TV with her. He worked hard his entire life doing animal processing working at animal processing plants, roofing, and whatever jobs that he could get. His joints were always swollen, but he kept going because that's what he knew how to do. He didn't have a formal education, but had a strong work ethic. But in 2009, he started having severe back and leg pain to the point where he struggled to move. He got laid off from roofing and lost his health insurance, and without coverage, he avoided going to the doctor. When he finally went to a free clinic, they wouldn't give him an x-ray or CT scan. They diagnosed him based on what he told them, and sent him to a chiropractor. After several visits with the chiropractor and Eddie heard a loud pop, and he was sent to the ER immediately. And that's when he finally was able to get the imaging that he needed. The scan showed cancer all over his spine, unfortunately already in stage 4 and already metastasized. It was terminal. And the part that hit the hardest was when she said, "It took my uncle getting a death sentence before he was able to get health insurance." Only after the terminal diagnosis did he qualify for disability and then insurance coverage based on the disability. He went to a cancer clinic in Illinois, and they told him if they had seen him months earlier that he might have had a fighting chance, but it was too late, and Eddie died at the age of 50. In his final days, she'd call him, and he would say, I'm so happy to get to see my baby Bird," and that was the last thing he said to her, meaning her daughter that she had just had. Hearing that story and then learning the historical context made it feel like really heavy, and it was really heavy. So fast forward to 1866, Rebecca Lee Crumpler became the first Black woman doctor in the U.S. She went south after the Civil War to care for 4 million newly freed people who had been released with no resources, no houses, and no medical care. The Freedmen's Bureau created the first federal medical program, but it was severely underfunded. About 100 doctors for millions of people, emancipated people. When Black people continued dying at high rates, racist theories emerged, claiming that it was nature taking its course, instead of acknowledging the lack of care and resources. So that pattern kept repeating. Hospitals stayed segregated for decades. Insurance was tied to employment, which excluded poor white people and Black people from receiving insurance and medical care. When President Truman pushed for national health insurance or universal health insurance, the AMA, or the American Medical Association, which was all white at the time, fought back against the universal health care because they feared losing profits. So by the end of that fight, healthcare was still segregated and still unaffordable for most Americans. Fast forward a little bit to the 1960s. Through the civil rights movement and the work of a Black physician named Montague Cobb, Medicare, the passing of Medicare it forced hospitals to desegregate. And within 4 months, 3,000 hospitals integrated. But even with that progress, disparities didn't disappear, and they still haven't to this day. Black women today are 3 times more likely to die from pregnancy-related causes than white women. And studies also show that Black Americans still die at higher rates from treatable cancers. So looking at Uncle Eddie's story alongside this history, it becomes clear that the system has always rationed care by race, by class, by employment, and by who is considered worth treating. His death wasn't just one family's tragedy, but it was a part of a much bigger pattern of delayed care, denied care, in a system that only opens its doors when it's too late. And relating this to social work, I think it is 100% our, not only our duty, but our ethical responsibility as future social workers to advocate for healthcare equity and healthcare equality, and for more access to treatment, or more access to healthcare for everyone, and for these gaps in care and the disparities in healthcare among like race or tax bracket, for those to be addressed in our country. So that's all I have. Thank you.